Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Tonsillectomy and adenoidectomy. Introduction. A tonsillectomy and possible adenoidectomy is a safe operation that removes the tonsils and adenoids. A tonsillectomy and adenoidectomy are not always performed together. The procedure can be performed on children or adults. Tonsillectomy and adenoidectomy, or TNA, can treat obstructive sleep apnea, other breathing or swallowing problems, or cancer of the tonsils or adenoids. Sometimes healthcare providers remove infected tonsils or adenoids when other treatments don't clear up the infection. In extremely rare cases, the surgery can treat severe bleeding from the tonsils or adenoids. This program will help you better understand what a tonsillectomy and adenoidectomy is and how it could help you or someone you know. Anatomy. The tonsils are glands located on both sides of the back of the mouth. The tonsils are part of the immune system and help fight infections. The adenoids are located behind the soft palate. The soft palate is the back muscular part of the roof of the mouth. The adenoids are also part of the immune system and help fight infections. The uvula is also located in the back of the mouth. It dangles down from the middle of the soft palate. Behind the uvula, there is a passageway that connects the nose to the mouth. The eustachian tubes connect the middle ear to the back of the nose. These tubes prevent the pressure inside the ear from changing too much. Swelling and inflammation around the adenoids can cause blockage of the eustachian tubes. If the eustachian tubes get clogged, the middle ear could fill up with pus and cause middle ear infections or inflammation. This can sometimes lead to hearing loss. Symptoms and causes. A tonsillectomy may be performed after repeated tonsillitis. Tonsillitis is an infection in the throat that happens in the tonsils. Tonsillitis usually causes a severe sore throat and fever. Swallowing becomes painful and difficult. Tonsillitis is considered to be chronic or dangerous if there have been 7 or more episodes in 1 year, 5 or more episodes per year for 2 years, 3 or more episodes each year in the past 3 years. Episodes that do not respond to antibiotics. The tonsils may get large enough to touch each other. When this happens, it is known as kissing tonsils. Another reason for a tonsillectomy is an abscess surrounding the tonsils. An abscess is a pus-filled sac. This rarely happens. Repeated middle ear infections in young children due to swollen adenoids and clogged eustachian tubes can lead to hearing loss. Sometimes hearing loss can cause speech problems. An adenoidectomy may be performed to help prevent middle ear infections. Enlarged tonsils or adenoids can lead to difficulty breathing while sleeping. This condition is known as obstructive sleep apnea, or OSA. Taking out the tonsils and adenoids help relieve the obstruction and cure OSA. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis and treatment. Treatment of tonsillitis and ear infections usually requires antibiotics. If left untreated, tonsillitis could damage other organs in the body, such as the heart or kidneys. A tonsillectomy is an operation aimed at taking out the tonsils. An adenoidectomy aims at taking out the adenoids. The combined operation is called a T&A. The surgeon may decide to do one or the other, or both. If antibiotics do not work to eliminate tonsillitis or ear infection, a tonsillectomy and possible adenoidectomy may be performed. These operations help to reduce the number of throat and middle ear infections. Before a T&A, the healthcare provider may request a blood test to find out whether the blood can clot correctly. Blood tests can help the healthcare provider make sure that there will not be too much bleeding after surgery. The mouth area tends to bleed more than other areas of the body. If blood cannot clot properly, there is a higher risk of bleeding too much. Tell your healthcare provider about any medications you are currently taking before the procedure. Many medications, including non-steroidal anti-inflammatory drugs, NSAIDs, can increase your risk of bleeding during the operation. Examples of NSAIDs are aspirin, ibuprofen, and Aleve. In cases of obstructive sleep apnea, or OSA, the healthcare provider can diagnose the problem on the basis of a history of difficulty breathing while sleeping, a physical exam that shows enlarged tonsils and adenoids. Procedure. A T&A is performed under general anesthesia, which means the patient is asleep during surgery. The surgeon removes the tonsils and possibly the adenoids in one of several ways. If you need a T&A, your surgeon can discuss which method they will use. This procedure takes about an hour or less. When the surgeon is done and bleeding has stopped, the patient is taken to the recovery area. After surgery, the patient is allowed to wake up in the recovery area. The patient will be given medications to reduce pain and swelling. When the patient has recovered from surgery, they can go home. Someone else should drive the patient home. The patient should wait to drive for 24 hours after surgery. Risks and complications. Risks and complications include those related to anesthesia and those related to any type of surgery. Your anesthesiologist or nurse anesthetist will discuss the risks of anesthesia with you in greater detail. Risks specific to a T&A operation include bleeding and infections. These are very rare. The healthcare provider should be called immediately if there is bright red bleeding for more than 1 to 2 minutes. The patient has a fever of 101 degrees Fahrenheit or higher. There is continuous pain that medicine does not get rid of. After the surgery. T&A is a very well-tolerated operation. A sore throat is normal after the operation. Watch for bleeding after a tonsillectomy. If the patient swallows a lot, the surgical site may be bleeding. It is important to check inside the mouth often for the first few days. It is easiest to swallow liquids and cold desserts at first. It is important to drink a lot of water even if it hurts to swallow. Otherwise, the patient could become dehydrated. Children will usually have a sore throat for about 1 week after surgery. Adults tend to have a sore throat for about 2 weeks following surgery.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The tonsils are glands located on both sides of the back of the mouth. The tonsils are part of the immune system and help fight infections. The adenoids are located behind the soft palate. The adenoids are also part of the immune system and help fight infections. Tonsillitis usually causes a severe sore throat and fever. Swallowing becomes painful and difficult. Repeated middle ear infections in young children can lead to hearing loss. An adenoidectomy may be performed to help prevent middle ear infections. A tonsillectomy can help patients who experience frequent throat infections. Sometimes healthcare providers remove infected tonsils or adenoids when other treatments don't clear up the infection. T&A can also treat obstructive sleep apnea, other breathing or swallowing problems, or cancer of the tonsils or adenoids. In extremely rare cases, the surgery can treat severe bleeding from the tonsils or adenoids. Understanding T&A, as well as the possible risks and complications, can help make the surgery a success. Thank you for using Explain.